Hello, my name is Jaspreet and I'm a second year's master's student. Today in this video, we will discuss the application scenarios. As in the clinical practice, you may encounter similar scenarios while caring for your patients. I hope you guys had a time to go over the scenarios before watching this video. Let's talk about the first scenario. In the first scenario, suppose you're assigned a 16-year-old female who is admitted to the hospital after collapsing at the school. She is currently alert, but pale, weak, and dizzy, and has a history of a type 1 diabetes. So what do you expect the diagnosis for this patient could be? And what are the nursing priorities while taking care of this patient? And what are the most important things to consider when treating hypoglycemia? So what is happening here? I hope you all diagnosed the patient with a hypoglycemia because first of all, patient has a history of a type 1 diabetes and admitted to the hospital after collapsing, which is one of the advanced symptoms of the hypoglycemia. So if you look at the scenario, it does mention some early symptoms of a hypoglycemia, which include pallor, tiredness, and a dizziness. So make sure you look into the advanced and the early symptoms of the hypoglycemia for this answer. Next question, what are your nursing priorities while taking care of for this patient? The first priority is to correct the hypoglycemia. So patient is at the risk for unstable blood glucose level. Your goal should be diabetes management and normalizing the insulin activity and blood glucose levels to prevent or reduce the development of further complications. For example, like a peripheral neuropathy or a peripheral vascular disease, because glucose control and management can dramatically reduce the development and progression of the complications. And the second is like monitor patient for any complications of a hypoglycemia and review the insulin regimen and the dietary intake of the patient to find if patient needs any teaching, if there's any teaching gaps, knowledge gaps regarding insulin administration. For example, like what type of insulin and how much insulin does she take, and at what frequency, how frequently she take. As a patient is an adolescent, so therefore, when discussing diabetes treatment options, consider patients' psychosocial needs as well. Next is what are the most important considerations while treating hypoglycemia? So first and foremost is always follow the hospital protocol and make sure you do not give too much sugar because the patient may go into the hyperglycemia if you give too much sugar. And also consider if the patient is alert and can swallow the carbohydrates orally, because if the patient is not alert or patient is unconscious, you might need to prepare an IV medication like an injectable dextrose solution for the patient. And next is continuously monitor the patient glucose level according to the protocol until the patient reaches the stable reading or the targeted reading, which is 5 to 10 millimoles per liter. So next scenario, Doug is 47-year-old man admitted to your medical unit with an ulceration on his right foot. His blood glucose level is 12 millimoles per liter. He tells you that he takes NPH insulin 40 units every morning and Humulin R insulin with each meal and at a bedtime. He says he does not need to take his insulin because this is a normal reading. So what would be your nursing priorities in this situation? What are some efficient methods you can provide to patient education? And while discharging a diabetic patient home, in addition to insulin education, what are the other education topics you need to include in your discharge teaching? So let's talk about the first question. What are the nursing priorities? So the first four, based on the blood glucose level, you probably have read the hyperglycemia ranges. If it's over 10, it is considered hyperglycemic. But if it is between 10 to 14, it is considered mildly hyperglycemic. But as we also discussed, that physician might set a different range or a different target for the blood glucose in different patients based on a patient condition. So first of all, you need to inquire what is the target range of this blood glucose level in this patient. Is there any different target range? Because we talked about in critically ill patients, there might be a different range for the maybe for a pregnant patient, there might be different range. So you have to inquire what is the set target range for this person. Because a patient might have a comorbidities due to which physicians sometimes recommend the high blood glucose level. And if we cannot find any set orders, then we assume that the target range is 5 to 10. You need to educate the patient regarding the normal range of a glucose level. And it's important because patient is already admitted with the foot ulcer. So you have to tell the patient that you have to keep the blood glucose between the range of 5 to 10 millimoles per liter. That will prevent the delayed healing of the foot ulcer. Next is the efficient teaching. So what are some efficient methods for providing patient education? First and foremost is before providing any education to patient, you need to assess the baseline knowledge. What language do they speak? Do they have any psychological deficits that prevent them from understanding or following your directions in education, in discharge teaching or patient education? So based on that, your assessment, you can use pamphlets, brochures, videos, or demonstration to provide diabetic education. And the second thing, try to have a family member attend the education session. First of all, family plays a critical role in the healthcare management. And also, it increases the chances that your instructions will be followed. At the end of the teaching, as a patient, ask the patient to explain step by step their disease or treatment to make your patient understand correctly, or you can call it a reverse demonstration. But if there's no procedure, you can ask the patient to explain the disease or the treatment. Suppose you want to ask the patient at what time you will take the insulin to assess if the patient understood what you are trying to teach. Next is when you discharge a diabetic patient and you are going to give insulin education, but what other educational topics should be included? So first of all, you need to teach a patient the symptoms of hyperglycemia and hypoglycemia so they can identify from those signs if they are experiencing either or. They should be educated on the foods to avoid, such as desserts, sweets, and foods that are beneficial to them as well, such as fruits, vegetables, high quality proteins. Instruct a patient to always carry a candy or glucose tablet with them in case they feel hypoglycemic. Also teach them the diabetic foot care, because due to peripheral neuropathy or peripheral vascular disease, the patient may lose a sensation to their feet. So teach your patient to daily assess their feet and to wear a well-fitting footwear And third thing, to cut the nails straight to avoid hanging nails. And the last one is patient is at an increased risk of infection. So you have to teach how patient can prevent the infection, because infectious diseases are more frequent and more serious in patients with diabetes due to hyperglycemic environment that favors immune dysfunction, decrease in antibacterial activity, gastrointestinal, and urine dysmotility. Thank you. I hope you guys have a good time in your clinical. Thank you.